Hi, I'm Corey Prout and welcome to another episode of On The Couch. Today I've got with me David Micallef, who's APA titled sports physiotherapist and also one of the partners here at Physiohealth. And he's going to talk to us today about lateral hip pain. Thanks for joining us, Dave.
Thanks, Corey.
So what do you want to talk about lateral hip pain today?
Firstly, lateral hip pain is quite a common injury we see in the clinic. It especially affects females, predominantly, especially the older female postmenopausal woman, and unfortunately it's an injury that happens a lot to people that are trying to get fit again, so people that have maybe had a baby or had a few years off doing activity and restart activity again, and then their tendons break down and they start getting pain.
So what are those structures that you're talking about that are causing the pain?
Well, I'll just show you the little hip model I've got, and basically this is the pelvis here, and we've got our hip joint, which is sort of right at the front, and with lateral hip pain we're talking about this region of the hip here, which is overlying this bone. And predominantly what happens is, or what we used to think happened was people would get inflammation and bursitis in a little sac of fluid that sits on top of this bone. And that could be very painful, and people can't lie on their side and have pain walking. More recently we've found out that a lot of the pain may also come from the tendons, so from the smaller glute muscles. So we have glute minimus and glute medius that attach onto this area, and we now know that it's a degenerative process of affecting the tendons, and we call that tendinopathy, and that has a role in compressing through that area, and people get sort of tendon pain or bursitis, or a combination of both.
Right, and so why do you think it occurs in people who are trying to get fit?
It seems to happen after people have had a few years off. So they might have had a baby, they may have just not done much exercise for a long period of time, and then they decide to do something about it, and they start walking, they start maybe running again, or doing stairs, or doing some sort of gym stuff. And basically the glute muscles over that period of time, when they have been less active, the glute muscles have got weaker, the tendon structure has got weaker, so that when they start doing stuff and the muscles and the tendons start working, the actual tendon starts breaking down, sort of, I like to think of it, it becomes overloaded. It's almost like an old rope that's sort of become frayed and weak, and then you start using it again, and the fraying sort of causes a weaker tendon, which causes pain.
So you get the irritation
there. So it's an injury that unfortunately happens a lot of the time when people are doing the right thing, when people are getting back into exercise, and then they sort of break down.
Just do a bit too much too soon, or too quickly.
Often the case, and it's a very frustrating injury for them because they're starting to get motivated.
So what are the telltale signs that people might be able to identify with this particular area that you're talking about?
It's usually a pretty easy area to diagnose. People will usually complain of very sort of exquisite soreness right over the bony part of the hip. So that's very much a very consistent sign. They usually report that they can't sleep on their side, so it disturbs their sleep. Often they can't lie on their other side as well, so that when they sleep on their side, if they drop this leg down, it sort of stretches through here and they get sore. So that's some of the more debilitating things, that they don't get much sleep, but with running and walking it can aggravate.
Yeah, I certainly find that similar position, people have trouble crossing their legs when it's a bit sore as well. So yeah, that sort of all fits in. And what do you normally find when you're assessing somebody with lateral hip pain? What are the things you?
Well, usually you look for the tenderness on the lateral part of the hip, which you normally find. You often normally find that their hip muscles have got weaker, so they've often got poor activation of their deeper gluteal muscles. Often there's some wastage in the lower part of their buttock. Often they actually get really tight up higher as well, and they do tend to get pain with stretching. So sometimes that they start doing what they think is the right thing, they don't just start doing stretching their glutes, and that can often stir it up a little bit. It can pinch it and aggravate it. Sort of pulling across like this can do more harm than good.
What about when they're doing functional activities, walking around? Any signs?
We're looking for assessing their how stable they are on one leg. So with a lot of people with the walking, and this is exacerbated when they run, that when they're standing on one leg and running, they might be dropping their hip a little bit like this, and that sort of basically lengthens the band from here to here via ITB, and so that as they run and compress, the actual bursa and the tendon get compressed through there. So we often, in single leg testing, we see that there's a weakness of their pelvic stability.
So how can physio help this problem?
Physio can help a lot with this problem. It's by starting off just with educating the patient that it is generally a tendinopathy kind of problem. So it can take quite a long time to get better, and people often just want a quick fix, so you've got to educate them that's not the case. And you need to educate them to not aggravate the problem, so that they must avoid sleeping on their side, and maybe even avoid sleeping on the other side. If they have to sleep on their side, maybe putting 1 or 2 pillows between their legs so they're not dropping down into that position. Asking to sleep on their back if it's possible. Avoiding the cross-legged position, which can compress and irritate it. Talking to them about monitoring their loads, so perhaps they have to cut down on some single leg exercise they might do at the gym, perhaps they have to stop running for a period of time, and just cutting it down. We don't like to stop people exercising, but we may have to change.
So aside from avoiding those particular activities, are there any other things that can help settle down the pain?
Well, so a lot of things we do in the physiotherapy clinic can help. So we often start by icing the area to settle down the acute soreness, massage and trigger point release work to the ITB band, to the gluteals, to the back, can help settle down the pain quite a bit.
Some needling, I use some needling as well.
Dry needling can be really effective in those spots as well. And then once the pain starts to settle, then the physio really needs to guide the patient through a range of strengthening exercises. So we need to start with some gluteal activation exercises, making sure that they're getting activation right at the back of the hip and that they're not overacting at the front of the hip. And once they're good at that, then we sort of retrain that in double leg.
It can be quite a tricky process too. It's quite specific, that area that you want to activate.
You really do want correct activation, and that can take sometimes a couple of weeks just to get them doing the right thing.
And then once you've started that strengthening process, then onto functional things.
So once the patient has good activation, once they can do it in 2-legged positions, then you're looking at bringing it into a functional position, like in single leg positions, trying to retrain how they walk with their pelvis, so that when they're walking, they're not
the typical
catwalk. They're not sort of tipping too much, and that's exacerbated a lot with hopping and running. You can assess that. Up and down stairs too, people often as they go down a step, they'll sort of might corkscrew a little bit like this, and that puts a lot more pressure on here. So trying to get the patient to have what we could try and just greater pelvic stability, so they're not doing this when they're strengthening, but they're actually controlling it down like that. And those sorts of things make a big difference to them. And then bringing them back into function with their sport activity that they want to do.
Excellent. And what are the common mistakes that people make when they're trying to look after this area?
The most common mistake is probably just trying to rush it, trying to get them, people who are really sore, getting them to do exercises that are too hard for them too early. So the patient wants to go, and you give them some strengthening, and they actually just need a bit of time to settle and to let the pain die down. Often people do too much stretching, so really stretching their glutes, or bringing their legs across like this, or stretching like this, which can sort of just pinch and aggravate the problem. And with exercises like clams and things like that, people can often either start them too early, or when they do them, they're not activating the correct muscles, and they're actually stirring up, they're probably making it worse.
Yep. Okay. And any other areas that could be confused with, causing pain in this area?
Yeah, well, it's close to the lumbar spine, so whenever someone presents with lateral hip pain, you do want to firstly just check it is their hip not coming from their lumbar spine and being referred pain from a joint or a disc. Conditions such as hip OA, about 20% of people with glute tendinopathy have hip OA, and also about 30% of people with chronic low back pain have glute tendinopathy as well. So it's often an injury. Often people have both. So you need to treat both. and that means in a lot of cases not just focusing on trying to treat the back, but strengthen the hip at the same time.
Mm-hmm. And something that's been more popular in recent times is different sorts of injections into those areas. Are they helpful for people like this?
Injection therapy can be really good. It can also not help much at all. So for the patient really wanting to get a quick fix and just feel better really quickly, an injection can often be a bit disappointing. But sometimes the injections do really have their place. So there's two main injections that doctors might use. Would be a cortisone injection into the hip, and that can be quite successful if it's primarily a bursitis and providing it hits the spot. And in some people who can't strengthen because they're in too much pain, it actually allows the condition to settle a little bit to then they can then start their exercises. I always warn people not to expect a miracle, and that there's still a lot of hard work. Certainly an injection into the bursa will not help a degenerative tendon, only exercise will help that. The second kind of injection is the PRP injection, or the blood injection, which is becoming a lot more in use because we're finding more and more that the problem is a degenerative tendon, not a bursitis. So, and again, the blood injection is not an immediate miracle type cure.
It has to come with the rehab.
Yeah, you have to do the rehab and the exercise. And I sort of tell people that you have to do your exercises, but a blood injection is probably going to increase your percentage rate of being successful at the end of a 10 or 12 week rehab. So the patient really has to put in a lot of hard work either way. And it's very frustrating for the patient who had an injection, get better for 2 weeks and then deteriorate again. But that's where you really need to get them on board with your treatment plan of being very geared up at strengthening.
Excellent, Dave. Well, thanks very much. I think that's some really valuable information there for patients who are having troubles with their hips. And so how can they get in touch with us if they're having troubles in this area?
The easiest way is to look on our website, www.physiohealth.com.au, and you can find our phone numbers on there.
Thanks very much.
Thank you.